Hello, my name is Elena and I am your Substance Abuse Wellness Facilitator. We will be looking at the coronavirus and ways to prevent the spread of viruses. Let's get started. COVID-19 is a disease caused by a coronavirus, a common virus that can cause what doctors call a respiratory tract infection. It can affect your upper respiratory tract, sinuses, nose, and throat, or lower respiratory tract, windpipe, and lungs. In early 2020, the World Health Organization identified a new type of coronavirus. This is the virus that causes COVID-19. The outbreak has quickly spread around the world. It spreads the same way other coronaviruses do, through person-to-person contact. Infections range from mild to serious. The main symptoms, fever, cough, and shortness of breath. Early symptoms are much like those of the common cold, but the virus can lead to pneumonia, respiratory failure, and in some cases, septic shock. If you're exposed and infected, symptoms can show up in as few as 2 days or as many as 14. It varies from person to person. When you have symptoms, they can be similar to a bad cold or the flu. COVID-19 will be considered if you have fever and breathing problems and you've traveled to places where the virus has spread. You've been exposed to people who have it within the last 14 days. COVID-19 mainly spreads from person to person. Most of the time it spreads when a sick person coughs or sneezes. They can spray droplets as far as 6 feet away. If you breathe them in or swallow them, the virus can get into your body. Some people have spread the new virus without being sick, but that's less common. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. The number of people infected by COVID-19 changes every day. If you're in an area where it's spreading, take these steps. Wash your hands often or clean them with an alcohol-based sanitizer. This kills viruses on your hands. Keep your distance. Stay at least 6 feet away from anyone who's coughing or sneezing. Don't touch your face. Coronaviruses can live on surfaces you touch for up to a few hours. This includes metal for 8 hours, copper for 4, wood, cardboard for 24 hours, and plastic for almost 48 hours. If they can get on your hands and get to your eyes, nose, or mouth, they can get into your body. There's no need to wear a face mask unless your doctor tells you to. You will need one if you've been exposed to COVID-19 or caring for someone who has it. There's no specific treatment for COVID-19. People who get it need care to ease their symptoms like rest, fluids, and fever control. Those with severe cases need to be cared for in the hospital. Anyone can get it, and most infections are usually mild, especially in children and young adults. But if you aren't in an area where COVID-19 is spreading, haven't traveled from an area where it's spreading, and haven't been in contact with someone who has it, your risk of infection is low. Older people and those with weakened immune systems or medical conditions like chronic bronchitis, emphysema, high blood pressure, heart disease, lung disease, cancer, or diabetes are most likely to get a serious illness. If you live in or have traveled to an area where COVID-19 is spreading, if you don't feel well, stay home. Even if you have mild symptoms like a headache or runny nose, stay in until you're better. This lets doctors focus on people who are more seriously ill and protects healthcare workers and people you might meet along the way. Call the doctor if you have a fever, cough, and trouble breathing. You need to get medical help as soon as possible. Calling ahead rather than showing up will let your doctor direct you to the proper place, which may not be your doctor's office. If you don't have a regular doctor, call your local board of health. They can tell you where to go for testing and treatment. Follow your doctor's advice and keep up with news on COVID-19. Between your doctor and healthcare authorities, you'll get the care you need and information on how to prevent the virus from spreading. Now let's talk about some ways you can stop the spread of germs. While this will most certainly help with stopping the spread of COVID-19, it will also help stop the spread of many other illnesses. Wash your hands. It's the single best way to avoid a cold. Once germs are on your hands, it's easy for them to get into your body when you touch your eyes or mouth. Wash hands thoroughly. Use soap and water, scrub for at least 20 seconds. Wash before you eat or prepare food and after you use the bathroom or change a diaper. If you're taking care of someone who's sick, wash your hands before and after being with them. Use hand sanitizer. It's the next best thing if you can't get to a sink. Keep a small bottle with you, at work, in your car, and in your purse. Buy one with at least 60% alcohol. Rub it all over your hands until they're dry. Clean your phone, tablet, computer, or any other highly used electronic devices more consistently. Be mindful of touching your face with your gloves. If your gloves are made of a material that can be washed, then wash them at night. If they cannot be washed, then it may make sense to invest some money and replace them as often as possible. Cough or sneeze into a tissue, then throw it out right away. If you don't have one with you, Don't cough into your hand. You'll just smear germs on the next thing you touch. Instead, cough into the crook of your elbow. Disinfect your space. You don't need to spend all day spraying disinfectant on every surface of your house. Still, if someone in your family is sick, use one to wipe down high-traffic spots like computers, phones, doorknobs, and TV remotes. Use disposables. Cold and flu germs can cling to fabric, so when someone in your house is sick, replace cloth hand towels and dish rags with paper towels. Remove water glasses and add paper cups in the bathroom too. Keep your distance. If possible, stay away from people who have a cold or the flu. If you can't, because you're caring for a sick family member, for instance, step up your hand washing routine and your attention to other defenses against germs. Take care of yourself. Experts think that healthy living may help boost your immune system, so make sure you eat nutritious food, exercise regularly, and get enough sleep. Stay home when you're sick. If you go to school or work when you don't feel well, you can make a lot of people sick. Although a cold or flu might not be a big deal for you, it can be serious for people with weak immune systems like young children, the elderly, or anyone with a long-term health problem. Working while you're sick isn't good for you either. It can make it harder for your body to fight off the cold. So do what's best for you and everyone else. Take a couple days off. Thank you so much for watching this lesson. I am Elena, and if you would like to learn more, please visit sawtoolbox.com.